Exercise during pregnancy. It is definitely a good idea to exercise while you're pregnant, but it is worth taking some time to note what type of exercise you take on. If you're a regular gym goer, or if you find you exercise regularly, whatever you do, when it comes to the early weeks of pregnancy, you may find that actually you do just want to rest more. The most important thing in those early weeks, definitely between 10 and 14 weeks, is to rest as much as your body wants to. This is not the time to be trying to push your body or go a little bit further. As your pregnancy develops, it's going to be important again to notice that though it's good to have strong muscular tone, there's going to be a point where you want to start to learn to release and relax the pelvic floor muscles, the core abdominal and back muscles, so that they increase their elasticity, which is going to increase blood flow to all the vital organs and also to your baby. If we're embarking on exercise programs, we want to make sure that anything we do is both going to support the pregnant body and also facilitate labour and birth when that time comes. If you regularly do lots of yoga, you do lots of Pilates, you run, you swim, you go to the gym, then the chances are you're going to have overly toned pelvic floor and abdominal muscles, and therefore it's going to be worth taking the time to practice something that teaches you to relax and to release those muscles at will, so that when it comes to birthing your baby, this is not an alien concept. Yoga is of course absolutely fantastic for pregnancy, both in the early weeks and supporting the relaxation and the resting that needs to take place, and also in mid-pregnancy to develop strength and stamina as your energy levels are stronger and higher. And then later in late pregnancy, really learning to relax, to soften and to open the space to birth from. It is important to make sure that you go to a well-qualified yoga teacher, just like it's worth going to a well-qualified instructor of any type of exercise. It is important that they've done specialist training in pregnancy and that they understand the pregnant and the birthing body, especially in how the hormones affect the physical systems. One thing I would suggest is that you definitely ask for credentials whenever you look at embarking on anything. There are lots of gym programs that will encourage you to keep going during your pregnancy, but I would caution you to be careful with step machines, with cross trainers, even with swimming breaststroke, because all of these actions can end up putting a lot of pressure, and misalignment can be caused in the pelvic region, which can lead to issues such as pelvic pain and problems with the symphysis pubis, which is not very nice. Beyond this, if you feel like doing it, doing it. But if you do value your pelvic floor, it's definitely worth avoiding any kind of exercise that includes bouncing, jumping, or anything that is going to excessively put pressure on the pelvis. You will know from your body whether you tend to be really soft and flexible or whether you tend to be more toned and therefore have less elasticity in your muscles. Those of you who are really soft, you'll need to learn to tone a little bit more to support the skeletal structure as your weight increases and the baby grows inside you. And those of you who are used to being toned are going to need to learn to soften a little bit more as the pregnancy progresses. Do have fun with what you're doing. Make sure you're enjoying it. And if you're looking for the best type of yoga for pregnancy, we would always recommend Birthlight Yoga.